Let's go ahead and begin. Great. Looks like we're going to be live on YouTube. Great. Good. So we hold these conditions. First of all, my name is Dr. Richard Sharma. Thank you for joining us today. Today, we're going to be doing our condition-specific talk. The condition is going to be on lower back pain. Now, this is a pretty big task because there's a lot of things that cause lower back pain, and we're going to go through it in a pretty, efficient way. We're not going to be able to cover everything, but I'm going to give you some great tips on how to manage it and also how to prevent it as well. So we do these talks on the third Wednesday of every month, and we're usually live on either Facebook or in YouTube, and also obviously live on Zoom for those of you who are on Zoom. So your video and audio has been muted, but the chat rooms are open. So if you guys have any questions during this talk, please feel free to leave it in the chat rooms. This talk is going to be roughly 20 to 25 minutes long, and there's going to be a little 5-minute question and answer time at the end. If you guys have any questions, feel free to put it in there, and the moderators will go ahead and send those questions. Great. Good. Let me figure out how to get this out of the way. Good. Let's begin. Okay, so for tonight's agenda, we're going to be covering some really main topics, okay? So we're going to be talking about how is lower back pain caused, and there is a variety of list of different things that cause lower back pain. So we're going to just touch on the more common ones. We're going to talk about how to prevent lower back pain. I'm going to give you 10 really good things that you could follow, 10 steps. There's some bonus stuff in there as well. We're going to talk about some exercises that you can do to alleviate your low back pain. They're going to be, some of them who've been in the program will recognize some of these, and some of them are going to be new as well. I'm going to go over this question because this was asked before. When should you see a doctor for low back pain? The medical field has an answer, and then chiropractors have an answer. Two different views, and we'll talk a little bit about that. We're going to talk about chiropractic's effectiveness for treating low back pain, go over a little bit of research on that, and then finally how chiropractic can help with your lower back pain. I'm going to go over two fun facts, and they're not so fun facts, but I was doing some research, and I found that what mammals and animals and things like this have low back pain? Is it just humans? Is it, do cats, dogs, do, other species of animal have low back pain? And I stumbled upon an article about Neanderthals. So Neanderthals were around 65,000 years ago. And what they saw in their spine was they too suffered from some sort of degenerative disc disease in their spine. So they also suffered from low back pain, which was, phenomenal to me. And when I started reading more about it, it happens a lot in bipedal mammals. So when we started walking on two legs, going from four, we started having low back pain. Okay. The other fun fact, is 80% of Americans will experience low back pain sometime in their lifetime. That is, it's astonishing that number is that high. I knew it was high. I didn't realize it was that high. Some more fun stuff that we're going to go over. Here's some famous people who suffer from low back pain. Okay, so George Clooney, he had a CSF leak, that is cerebral spinal fluid leak. This was really bad. He hurt himself on the movie Sierra, and he had some sort of injury on there and caused him to have spinal surgery. George Bush, disc herniation. Usain Bolt, Sarah Michelle Gellar, both suffer from scoliosis. Scoliosis can have pain or non-pain. Both of them suffer from the pain. Okay. Harrison Ford, disc herniation. Charlize Theron, and then Tiger Woods. Tiger Woods is going through a lot. He was just in an accident, shattered his leg, some other stuff going on with him. But prior to that, he's also had multiple spinal fusions throughout his back. He's been suffering from a lot. And then Peyton Manning, Super Bowl winner, disc herniation. So there's a lot of different things can cause low back pain, and we're going to talk about that. So as you can see, the list is long. We have muscle strain and ligament sprain. So we call that strain sprain. Lumbar herniated disc, degenerative disc disease, facet joint dysfunction, sacroiliac joint dysfunction, spinal stenosis, spondylolisthesis. You got osteoarthritis, deformities, traumas, compression fractures, infections, tumors, autoimmune diseases. We're not going to go through all of these. We're just going to go through the four most common ones that you guys can probably relate to the most. So I'm going to highlight those. So that is the muscle strain or sprain. This is something that generally happens when you may be moving really fast or trying to stop really quick, or say you're trying to lift a great deal amount of weight, such as doing a deadlift, and you either sprain or strain your back. And I'll talk about exactly what that is. Then we'll talk about the infamous lumbar herniated disc. That's how I got into chiropractic. Had a disc bulge. It's just a lesser form of a disc herniation. Then degenerative disc disease. This is something that happens over long periods of time. That could happen through trauma or micro traumas or just poor posture. And we'll go through what that is. And then finally, traumas. Different traumas that can happen, that can occur, that can cause you to lose the curves in your spine and cause you to have a low back. So let's talk about the first one, strain or sprain. So we're just going to differentiate the two. So a strain is when you have a tear. Could be a little micro tear or a large tear, but it's a tear in the muscle or the tendon. So a tendon attaches muscle to the bone. Okay. Now, we have some more people joining here. Good. Okay. A sprain. Let me get that out. Sprain is when your ligament gets teared. Okay, so a ligament attaches bone to bone. So if you think of someone going into like a weightlifting room and they're lifting a great deal of weight, they're more likely to sprain their back first before they sprain it. Spraining is a far worse injury and has longer healing times than straining your back. And we tend to see people who strain their back more often than sprain is a little bit more of a, like I said, a longer recovery. Now let's move on to, okay, good, the lumbar disc herniation. So a little bit of a quick anatomy here, just orientation. We're looking at a bird's eye view of this. On the side over here, on this left side, is a normal vertebra with the disc over here. And also I want to point out this is your spinal cord, right? Your spinal cord sits right in the middle of your spine. And these nerves right here, these yellow parts are your nerves that come out. Now, when you have a herniated disc, you have this nice area in the middle. This is your nucleus pulsus. When you move in certain directions, and if your back is compromised, you can herniate your disc. This inside part can come out, actually compress on the nerve root and cause a variety of different symptoms. So you will have also point tenderness at the area in your low back, but you could have tenderness also and pain, tingling, and numbness down that nerve root. So you can have pain, tingling, and numbness that goes all the way down the back of your leg. This can be a sort of sciatic pain. It can go all the way down into your foot, right? And depending on what nerve and what area is being compressed, it can cause pain or tingling or numbness at different parts of the foot. In some serious cases, if you have a severe enough disc herniation, you can even have something called cauda equina syndrome, where you may even have loss of bowel function, which is really serious. Emergency room visit right away. Next, let's talk about the lumbar degeneration. And this is what we see very commonly in practice. So we're just going to go through. The left is what normal looks like. This should be your nice, perfect lumbar curvature. It should be a nice 40-degree curvature in your lumbar spine. What we're looking at over here is nice square shapes separated by this dark space right here. This is your disc. We want this to be nice, big. The bigger, the better. that just represents a healthy disc. And then also there's these little holes here. I want these holes to be really big because this is where the nerve exits out. Now, when you get into some sort of trauma, whether that be postural trauma, micro traumas, car accidents, falls, sports injuries, uh, first thing that happens is your spine goes out of alignment. Okay, so you lose this nice curve that you get, and you get to here. This is considered phase one of degeneration. You lose that curve. Also over here, it shows a little bit of disc thinning over here. Now, a lot of people may or may not feel pain in this area. A lot of times people will try to fight through this pain and to get better, but if this doesn't get treated here, you move on to phase two. This is truly what arthritis looks like in the spine. This is when your bones actually begin to change. You start to have some bone spurs formation. You'll have thinning of the discs. And these holes over here are getting tinier and tinier, and that's just compressing on that nerve. Then if this doesn't get fixed, move on to phase three. Phase three is pretty much bone on bone, really decreased quality of life. There's a phase four. We don't really even have a picture of phase four. That is, surgery with the lifelong time of medication. So that's what that is. Really important that we are able to catch you around this area to get you back to here, or better yet, see you right over here and get some preventative care done. Okay? Let's talk about some traumas. I don't know why I put this in here. Okay. So we're going to talk about some traumas. All right. First of all, it's hard not to look at this, but we're going to look over here. These are some really common things that just happen. It can be as simple as lifting up a little box that can cause you to, strain your back, have some sort of disc herniation injury, lifting a heavy wheelbarrow, or even, and I like this, what it's showing, is even having improper seating posture, while you're at work for, say, 6 to 8 hours out of the day, can cause your spine to become misaligned. That's a form of trauma. And this guy over here, I don't even know what he's trying to do. I initially thought he's going for a deadlift, whatever this is. It's not good for your back. And the reason it's not good, we're just going to point out a couple things, right? Really rounded back, no core engagement. You can see he's shifty on his legs while he's lifting a great deal of weight. I think he said 150 kilos. This is really improper form. But the main thing is you can see he's increasing his intrathecal pressure. What that means is he's squeezing all of his insides, right, while he's lifting a great deal of weight. This is a very common way how you herniate your disc in your low back, or you sprain or strain your back. Don't do this. All right, so we're going to talk a little bit about prevention now. And these are just 10 easy steps that you can follow at home to really prevent you from having low back pain. Okay. So, and this is also applies to people who already have low back pain and helping you get out of low back pain. Okay. So, number one, eat healthfully. Okay. So, eat healthy foods so you can keep the body weight within a healthy range. I cannot stress how important this is. Doctor telling you that you need to healthy, of course. So when you have increased weight, especially in your abdomen, it will cause you to have a great deal of stress on your lumbar spine. Okay, and it will cause you to have increased amount of pain. It will even cause the curvature in your spine to change. Now, I like to relate also this to thinking about women who become pregnant. Right, when they become pregnant, they're growing a human baby within them, and they are carrying a great deal of weight over here. It is so essential, so important for pregnant women to get their spines checked by a chiropractor during pregnancy, before pregnancy, and after pregnancy, because your spine is very compromised during that point. It is really essential to get. Okay. Number two. Get regular exercise to keep your back muscles fit and flexible. I'll have to elaborate on that. 3 and 4 kind of go along. Avoid prolonged sitting. Right. I say this because a lot of people are working directly from home, especially during COVID. And when you do sit, please maintain good posture. I'm going to talk really quickly about posture in the next slides. Want you to use proper lifting techniques. Lift with your legs rather than your back. Most people are forced to lift objects on a daily, and when you don't have these proper lifting mechanics, this is when you get hurt. And it doesn't have to be a heavy object that you're lifting. You can lift something light in an improper way. If your spine is compromised, it will give. Okay. Let's continue. Number 6, avoid frequent bending and twisting, especially while lifting heavy objects, such as when you're shoveling, whether it be shoveling snow. We don't have to do a lot of that in California, but even if you're shoveling dirt, whatever that may be, that motion, it really, you lose that curvature when you're bent over like that, and it's a compromised position. Number 7, avoid situation where your spine is being vibrated for long periods of time, and such as when you're riding in a motorcycle, okay, or say you're using a tool for a long period of time that is causing your spine to vibrate. Essentially what you're doing is you're creating small micro traumas throughout your spine. We tend to see that in people who ride motorcycles. 8, get enough sleep each day. Rest is very important. Stop smoking. This is a big one. Smoking affects healing in general. Chronic smokers generally have less blood flow throughout their body, especially to their extremities, and would ultimately make it hard and difficult for the body to heal. So if you're having some sort of low back pain, smoking is one thing that your nervous system. It's one more thing that your nervous system has to overcome in order for your body to begin to heal. And then 10, of course, wellness chiropractic care. Getting to that point where you're out of pain, your body's functioning optimally, and getting regularly checked by your chiropractor to stay in that wellness state. And then a bonus one, supplementation. So this is something that has been, a more recent thing because COVID, people are staying indoors a lot, and they're having all sorts of deficiencies, right? And one good way to check it is testing your blood chemistry. Get your blood tested. And in your blood test, you'll be able to see different areas that you need to be deficient in, such as, having a vitamin D deficiency can actually lead to having low back pain. That's what the research shows. So really important stuff there. Let's quickly talk about posture and sitting posture. Some of you guys who attended my talks before have seen this prior. But essentially, you just want to be sitting all the way back in your chair. You want to have this 90-90-90 rule. You want 90 degrees at your hips, 90 degrees at your knees, and 90 degrees at your ankles. You want your shoulders to be relaxed. You want your eye level to be at screen level. A lot of you guys right now are probably looking at devices, iPads and things like that. And I know they're not designed to really be put up, but it's important. Okay, let's go over some exercises. This is really great. I love this. So first of all, we have a QR code here. That QR code is to our playlist. It's called Lot 5i, done by our very own Rachel Dang, who is our wonderful TA. So this one is called the Bird Dog. This is really great for tightening your core. And this can actually be done as a progression. So you can start with just being on all fours and lifting one arm. This is what she's showing here is more of an advanced progression where you're doing both at the same time. And the main thing is you just don't want your hips to be turning too much while you're doing this. You want to just be engaging your core. This is really great exercise for low back. Let's talk a little bit about stretching now. Doing the cat-cow. A lot of you guys who are in the program have probably gotten this stretch before, the cat-cow stretch. This is excellent for really stretching out the low back and also compressing it, giving those lumbars a lot of motion in your spine. Once again, here's another QR code for that. Going through it, it's a 5-minute video. It's a great video. Definitely recommend you guys checking that out. Okay, and the last stretch we're going to give today is the side plank. This is more of an advanced stretch. Not everyone is going to be able to do this initially, but the QR code on this one is actually for a modified version of it, where the knees are bent, and you can progress to doing something like this when you're ready to. But like I said, again, all of this is all about tightening up and strengthening the core so that your low back bones can stay stable. A tight core is really the key to getting your lumbar spine stable. Right. Let's talk about when you should seek out care for low back pain. There's definitely two different versions of this. There's the medical profession, and there's the alternative medicine. So according to the medical profession, you should seek out care for low back pain if you're having low back pain. If your low back pain doesn't improve within 6 weeks, I think that's far too long to wait, before you seek out care. Okay? If your pain becomes intolerable, if you develop numbness, leg numbness, or weakness, if you're having difficulty controlling your bladder or bowel. BJ Palmer, he's the developer of chiropractic, said, medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. See, medicine really focuses on more so when your body stops functioning and appropriately, and treating those symptoms and getting you back on your feet. Right? Chiropractic care, really focuses more on the other end of prevention of pain and optimizing your body function. We'll talk a little bit more about that. So this is more so what we're looking for. When should you seek out care for your low back? When your body is in pain. Your body is when your body is in pain, your body is sending already a response that something needs attention. So this means that your body's already failed to keep you healthy. Okay, so it's kind of far too late. Pain is generally the last symptom of an underlying issue. Okay, you can never seek out care too early, and when it comes to, especially when it comes to your spine, because it houses your spinal cord, which is your nervous system, right? So it powers everything in your body. Even the most minor accidents, falls, sports injuries can cause misalignments in your spine. And like I said before, you may not feel the pain then, but it's really important to at least go get checked for that to make sure that you're not entering that phase one of degeneration. Okay, so once you seek out care for your low back, especially if you're having low back pain, it's now. Good. Right along. We're going to quickly talk about a little bit about chiropractic effective. Is chiropractic effective for treating low back pain? Obviously, it is, but the research shows that that it's very effective. So, chiropractic care is more effective than medical care when it comes to treating low back pain. So, what that looks like is they call it spinal manipulative therapy. That's what the adjustment is. That's the term that they use in medicine. But when you compare it to medical care is treating you with medications and medicine. So what they see is that spinal manipulative therapy was, significantly better than pain medication in improving, your pain intensities that you have. And they also showed that in subjects with chronic low back pain, spinal manipulation was significantly more effective than a placebo group in reducing the VAS is just on a scale of 1 to 10, how bad is your pain? At the end of the nothing new, but main thing is that when you're dealing with the spine, it's a structural issue, not necessarily something that can be solved with a chemical drug. A lot of those drugs are just focused on fighting off the symptoms of pain, which it's just turning off that alarm bell in your system, which isn't always the most helpful thing. So let's talk a little bit about chiropractic and low back pain, and what is chiropractic doing? Why is it that chiropractic works for low back pain? So over here, this is what is considered a nice, healthy spine. It has nice curves, nice disc spaces in between each one of these vertebrae. It's a little bit small here, but the main thing is you have these nice holes that we talked about. These holes should be nice and big. And the reason I point these out is because if you look over here on the right, this is where the nerve exits. Now, the nerve is the main thing, right? The nerve is what attaches to the muscles and organs in your body. And now, if that becomes compressed, whatever that's attached to, that muscle, that organ, is not going to be functioning the way it's supposed to be functioning. It's not going to be functioning at optimal. Now, your body has a very, very hard time healing when your organs are not functioning at optimal. So, something to think about. And this is just what a subluxation looks like. And this is a lot about what chiropractors do. We look for areas that are subluxated, that the bone has become misaligned. And the main thing I want you to look at is, as the bone becomes misaligned, there's some sort of trauma here. This area right here gets smaller and smaller and can eventually end up compressing that nerve. And if not fixed, this disc right here will begin to degenerate because it has a lot of pressure on it. It'll get smaller and smaller, close up this hole. So it's really important to find these areas, get these areas adjusted, and get them moving. This is essentially why chiropractic works, right? The other side of that is, chiropractic is not about back pain. Okay, back pain is something that chiropractors do, facilitate the body in treating, but chiropractic is a lot about optimizing the health and a lot more so on prevention of even getting into pain. Getting your spine with nice curves and being the most optimal. Okay, that's all I have for today's talk. We ran a little bit over. I said about 25 minutes. That's good. If you guys have any questions at this time, please feel free to ask. I know that's quick. We couldn't cover everything that I wanted to, but I like to keep these talks short and concise with a lot of information. So I'll give it a couple minutes and we'll hang out here. Good. Let me find out how to open up the dialogues. Good. Good. So there are a couple questions here. All right, so we'll start with the first one. The first one is, how many adjustments do we need to get rid of low back pain? Great question. It really all depends on the health of your spine and also the severity of your injury. If you have a really severe injury and your spine is already compromised, not so healthy, you have a lot of degeneration throughout your spine, it's going to take a longer period of time. There's a saying where you can't walk 10 miles into the woods and expect to get out in one. It's going to take some time. Now, if someone has an acute injury and their spine is fairly healthy, they just lost some of the curvatures from the injury, that's going to take far less time. Good question. Another question we have here. What angle should my wrist be while I type? The angle should be neutral. Okay. So essentially let me see. Essentially, you don't want to be like this. You don't want to be like this. You want to be neutral as possible. And really, this is all going to depend upon where your keyboard sits as far as the height. So you do want to be, at 90 degrees, also at the elbows where you can straight ahead and be able to type, use your mouse around. Good. Find that my wrists are most comfortable when I don't bend them. Yep. Great. Let's see. We have another question. Is a sit-up good for low back pain? This is a question that we get all the time. So when you do sit-ups, right, your lumbar spine actually has this nice C-shaped curve, okay? And when you do a sit-up, let's say you're like this, you do a sit-up, you're really stretching that spine over like this, right? You're almost compromising, you're in a very compromised position when you do that. Also, when you're doing a sit-up, you're increasing that intrathecal pressure that we talked about, all that pressure inside. You tend to have your abs really tightened. A lot of people who don't do really proper sit-ups will be yanking on their head down, really losing that curve, and can cause you to have low back pain. It can cause you to be injured. So we would recommend doing, maybe a different type of ab exercise rather than doing sit-ups. Good. We have some more questions. This is an interesting question. Can ankle sprain lead to low back pain? Yes. Okay. The real connection there is, a lot of times when people have some sort of foot injury, uh, they begin limping on that foot, but they'll begin favoring the other side. And a lot of times when you begin to activate one side, say your left side more than the right side, and you begin limping, you're going to be increasing the strength of those postural muscles, also the stress on those postural muscles. And, that's still a form of trauma, micro trauma that you can put on your spine. It can throw your bones out of misalignment. Yeah, it's just part of the healing process. Good. Some great questions. I think that's it for today. Um, Looks like we're all good. We had some great questions. I want to thank everyone for joining us today. Oh, our next talk is going to be on the next month, third Wednesday at 7 p.m. same time, and it's going to be on knee pain. Knee pain is another very common injury that we see. A lot of people who are currently seeing have knee pains that I can just think off the top of my head. Many people. So we're going to go ahead and draft up a good presentation for that. So please join us next time for our talk. Then we'll send out all the emails and reminders. If you guys want to rewatch this or show your friends about this, it is going to be posted on our YouTube channel. If you know anyone who can benefit from this talk. Thank you guys for coming. I'm going to go ahead and stop the share. Thank you guys.